It's a really exciting day for Full Arch Masters. We have about 28 doctors here for our event this weekend. Following the lecture component tomorrow and the next day. And the next day is going to be our live surgical modules, where the participants in the course are going to be able to use what they've learned in the first couple of days and then apply it to a real surgical setting.
I think that anyone who wants to go into the full arch arena, they need to learn how to do the restorations and surgeries themselves. Whether you're a periodontist or an oral surgeon or a general dentist, if you're going to be doing full arches, you really should learn how to do everything yourself. And that's why Dr. Dunlop and I partnered together, because we think that the patients can really benefit when the doctors have learned the restorative digital workflow from Dr. Dunlop and the surgical workflow from myself, Dr. Dunlop, and Dr. D'Souza. That's why we do these courses a few times a year. And I think that the synergy of having multiple experts together is what makes our course so unique and better for doctors that wanted to do this.
Yeah, it has been quite smooth, because we Full Arch Club in Europe, Full Arch Masters here, we share the same ideas and the same concepts. So it's we don't need to talk too much about things, because we are thinking about the same things. So when we look at a case, pretty much we plan the same solution for that case, and we would perform it the same way.
The live patient part of this course is probably the most important part. Because you can always watch videos online, you can always talk to people, you can read stuff, but you never really learn it until you actually see it or you actually do it with your own hands. You can picture it, you can train it on models, but once you're doing it, and actually the fact that have somebody to hold your hand, to do it, to angle it, every small little 3-degree angle, makes a big difference. So it's a huge part. I mean, being live patient, it's a huge part of it.
There's only so many things you can do on a cadaver, or you can do on a model skull. Because even today we tried to do a trans sinus, and we had to abort and place an implant somewhere else. So to be able to feel that tactilely and then deal with blood and deal with different tissues is really important.
What excites me about this course is that we get to have the best and the brightest implantologists in the world to come here and give us the best details, advice, feedback, to make us the best we can be with respect to our techniques, and ultimately the best outcome for our patients.
Any advanced surgical course, I think, needs to be hands-on, because that's where you're going to learn it the best. Working on a model is not the real thing.
Cadavers, models, pig jaws, whatever, you're not going to get it without doing a live surgery and actually having other eyes on you doing the work and doing the treatment for people and changing people's lives. The pressure's on, and it's better for you, and you go home and you're a better clinician because of it.
Well, for one, the amount of hands-on patient experience, also the fact that the atmosphere here is very friendly and fun. Everybody has a very fun energy about it, and everybody's very enthusiastic about full arch dentistry. And the environment is just really conducive to learning, even if you have a lot of experience or if you have none. Everybody's very supportive.
Well, I have been to other institutes. They just seem to have their act together, really from start to finish. They treat you well when you walk in the door, throughout the course. When you leave, they check up with you. I mean, it's a great organization. I'm happy to be part of it.
It's very well organized. I think the digital part of it is very unique. Not all the full arch cases or full arch courses or implant courses are digitally oriented like the way FEM courses works.
The techniques where you think you've reached the limits, that where the cases are hard, where you think you have to take that extra step to go out and help patients. This is when this course steps in. There are some limitations with basic all-on-fours that requires special skills, and this is what this course is for.
It's very specific, very focused on what I want to accomplish, which is full arch immediate load. Just learning these advanced techniques that Bernardo teaches, that's what I've been looking forward to the most, especially after watching all his videos.